Ladies and gentlemen, now this man, Dr. Oliver Sunderman, is a clinical vice president from Intellect and he's here today to talk about mental health. Now, this man, he looks like an athlete. In fact, he is or was a rock climber before. Amazing man. And ladies and gentlemen, all of us, we do worry. We do have things that's keeping us occupied in our mind. Trouble starts here. So today, we're going to have Dr. Oliver to tell us more. Here we go.
Thank you. Thank you very much for your kind introduction. Okay, welcome everyone. Thank you for having me. It's a pleasure to be here. So today we're going to talk about mental health. We just heard Dr. Lee talk about health, and mental health is really, the other side of the same coin, really, because there's no health without mental health. And in this talk, we're going to specifically focus on the workplace. You may have heard the recent research that our managers are just as important for our own mental health as our spouses, and the workplace plays a huge role in our own emotional well-being. So I'm going to talk to you generally about mental health, but we're going to drill into the workplace, and we're going to talk about how we lay the foundation and the skills for a thriving workplace. So let me show you what we have prepared. So foundations first. I'm going to give you some hands-on tips how you can identify mental health issues. Then importantly, we move to the practical section, how you can support each other, colleagues and so on. If you're a manager, you can support your teams. And if you're a colleague, you can support your peers in the workplace. And then we'll be talking about the solution Intellect brings to the market, which is heavily, heavily science-backed. And I'll be honored to walk you very briefly through what we have to offer. Okay, so now I told you what I'm going to tell you. Now I will tell you, and then later on I'll go over what we covered, and then we move to the Q&A. Okay, so foundations first. So the old view of mental health really is that you're either sick or you're well. But we know very well now that this is not the case. So the mental health spectrum is widely accepted now. And depending on our life circumstances, what's going on in our families, perhaps what we experience as children, we're more or less vulnerable to stresses in our life. And if things are really, really off and we struggle, we may be in the red section. That's when we may be in need of clinical help. So that's where people have depression. They may not come to work. They may struggle generally with life, pull themselves out of bed, and be generally very unwell and in need of medical and clinical help. The bulk of us are actually in the orange, in the yellow section, which is it's the surviving bracket or struggling bracket. So we may have some sleep issues, we may struggle with burnout, which is very common in this part of the world, and we may generally go to work, but we may not be at our best, or we have some problems in our families. And in the green section, that's where people are generally very, very well. And the focus is a bit more what we can do to thrive further, okay? And we can shift along this spectrum. So once you have a mental health problem, it doesn't mean it's going to stay with you. With the right support, I strongly believe, that most of us can make a good recovery. And this shouldn't be news to most of you, especially since the pandemic. Everyone talks about mental health. It's probably the only good thing that's come out of the pandemic, that we're more aware of mental health issues. And this is a survey Intellect did last year that made Frontline News. We surveyed 1,000 workers in the Philippines, 1,000 in Indonesia, and 1,000 in Singapore. And generally speaking, we found across those countries that mental health wasn't very good, and you probably knew that already. Interestingly, we found that the working hours were the longest in Singapore, and that was predictive of poor quality of life. And of course it makes sense. If we work very long, there's less time for us to sleep, right? And sleep plays a very, very important role for our mental health. So burnout is very, very real, and we're going to talk a bit more in the upcoming slides. But first I wanted to share this landmark study that came out of Duke NUS and IMH a few months ago here in Singapore, and really is a landmark study because this study showed that about 14% of employees, of workers in Singapore, have symptoms of depression or anxiety. It's a very large number. And of course, that comes with a huge cost, right? So if we're not well, it's going to be difficult to go to work. But the real big finding from this study was the hidden cost of mental health. So people coming to work not missing work, coming to work, but underperforming because they can't focus, they can't concentrate. And that's a bit harder for managers or colleagues to spot because the colleagues are physically there, right? But they may not be at their best. And that comes with a huge cost, not just to the individual, but also to the organization. And it's called presentism. So traditionally, what companies have been doing for 60, 70 years now is to offer their employees access to what we call an EAP, an employee assistance program. And usually that means a helpline employees can ring to get in-the-moment support or get some legal or financial counseling. But it's quite reactive, it's usually not culturally nuanced, and it's designed for non-utilization. So usually it's about maybe 1, 2, maximum 3% of the workforce using it. And most employees are also not aware of it. So it's well-intended, but not really working. So let's look at what is working. But first, this is a quote I quite like a lot from Arianna Huffington, who says that a culture of well-being really is about prioritizing employee mental health and offer support so that all can not only survive, but thrive in the workplace and in their personal lives. And that's very important. We're not just talking about the absence of mental health. We want to lift up people so that they can really thrive, right? So move along on that spectrum. We want to get people into the green bracket. So how do we do this? So let's first talk about how we identify mental health challenges and how we can create psychologically safe workplaces. So burnout is something you probably all have heard about, and it's a very, very real problem. It's an occupational hazard, and basically it means literally that the battery is empty, people feel exhausted, they're disengaged, and they're at much higher risk of developing depression or mental health problems. And this is a typical cycle. So when employees join, they're hopefully motivated and they're excited, but then the workload takes over, or there may be a mismatch between the skill set and the job scope, and there's some dissatisfaction creeping in, and they may struggle with personal boundaries, checking emails at night, they get overwhelmed, and then at some point they feel empty and they're breaking down. And of course, we want to prevent that. So here are some signs for you can look at, and of course, this is not an exhaustive list, but just some indicators that might show that a colleague is having burnout issues. So it could be that they're missing deadlines. It could be that they're more withdrawn from their colleagues, that there's conflict in the team. It could be that they struggle to focus or remember things. They could be absent, and that could be surprising if usually they're quite reliable and coming to work, and mistakes might increase. And a really, really good sign that sums it all up is looking for change. You know your colleagues usually, right? And if they come to work and they look different, they're missing deadlines and any of those symptoms, you probably have an inkling that something isn't right. And there are also physical signs to look out for. So what could that be? For example, if your colleagues are unusually tired over several days, if they complain about headaches, if they share with you they really have sleep issues, which of course is very common, but again, we're looking for change. If they complain about gastrointestinal issues, if there's weight changes, or if they generally look very disheveled, that could be a sign that something is off. And there's many, many reasons for workplace sort of mental health issues and burnout in particular. And these are just some common reasons. So it could be that there's a lack of co-working support. It could be that the demands are too high. Very importantly, a lack of recognition. So people feeling not seen, not valued, not heard in the company. So really, if you're a manager, listening into this call, do assure that your team gets the necessary visibility, because it plays a huge role. It's protective. And of course, if there's bullying, that's an absolute red flag and a no-go. Hopefully, your companies have whistleblowing channels, and hopefully you trust your manager or someone in HR if you spot bullying or if you become a victim yourself of harassment. So please don't suffer in silence. Unfair treatment as well. If you feel as an employee that someone else gets promoted and you have deserved it better, that can also really lift up. trigger resentment and contribute to burnout. And lack of personal boundaries is something probably many of us can be familiar with, right? Our boss is pinging us maybe on a Sunday, and hopefully you have workplace cultures and guidelines in place that don't allow that. Okay, so we've covered the general signs of people not presenting well in the workplace. Hopefully that will help you to be more aware. But being aware is only one thing, right? So that's great, you have to be aware, otherwise you can't help. But now, what's next? What do you actually do? And I'll be sharing with you, very high level, a brief sort of guide you can use as a manager, but also as a, generally as a colleague. So first of all, you have to approach the colleague or peer you perceive to be, suffering some mental health problems, okay? That's one. You then have to listen in a safe way that is non-judgmental. We'll come to that. You have to then give support and information. So that could be the company's EAP, or it could be signposting the person to the local GP or someone else. And really encouraging professional help is super, super important. And here are some things you can do when you approach someone, right? There's many things that I'd say, could go wrong, but first and foremost, the biggest mistake probably is not to speak. We may have a belief that it's better not to talk about mental health, and there's still a lot of stigma, and people, shy away from talking about mental health generally. So I've spoken to some of my own clients and patients who told me that, they'd rather not talk about it. And but I do say, I would like to encourage all of you to not be silent and passive. Do approach, but how do you approach? First of all, seek permission. So if you see a colleague who's struggling, you can approach, you can say, is it okay, do you have a moment? Shall we grab a cup of coffee or a cup of tea? Do you want to have lunch? So don't talk in front of the rest of the team. Also, avoid asking why. Ask open questions and go with behavioral science. You can say, I noticed you've been coming to work late, and I wondered whether you're quite tired, and I'm really here to help you, and just wonder whether you want to have a chat. Okay? So don't ask, why are you off? Just say, I noticed you seem quite tired. Do you want to talk about it? Okay? And use reflective statements. You can say, that must be quite difficult for you. Show that you care, validate their feelings, okay? And make it clear that you're there to listen. And how do you listen? So try not to be judgmental. It's difficult. Humans, we all have ideas how the world should be, right? But do consider that people have, of course, various different backgrounds, and your role here is not to solution. It's really about listening in, and it can be okay to remain silent for a bit. Don't rush in with a solution right away, which I think many of us tend to do, okay? And it's okay to have a few moments of silence, for sure. And then give emotional support and understanding, okay? You're not a therapist, okay? But try and be actively finding out what's going on. If they trust you, listen in to what they have to share. Maybe they struggle with their marriage or their children. Maybe they're dissatisfied in their jobs. Just listen in and validate and get a better idea of what's going on. And what Intellect has recently done is we've recently been awarded the Mental Health First Aid license. So that's precisely what I've just sort of high level touched on. Mental Health First Aid is a very practical 12-hour course that equips people, employees or people in the community, managers, to, one, have a better understanding of mental health and be aware of the various issues, but most importantly, to have the practical skills to have that conversation I was just going over with you. How do you approach someone? And there's a lot of role-playing going on and practicing various situations, whether someone has depression, anxiety, sleep issue, or perhaps more severe, they may hear voices, or they may be very paranoid as well. And this is a very brief sort of summary of what that is. Mental Health First Aid is an internationally established program. It's the only one with a large research-backed sort of science base behind it. It's culturally adapted, it's localized as well, and it's heavily focusing on the skills part. Okay, so I'm conscious of time. Now let's talk about what companies can do to support their employees in their mental health journey and create those thriving workplaces. First, let me share with you the Intellect model. That's a very simple model that allows the organization to assess whether the solution they have in place, the mental health benefits, are sufficient. So first and foremost, the base. It's about mental health literacy and mental health skills. So you want to know whether your corporate well-being program reduces stress, reduces burnout, depression, anxiety, and so on, so that there's some efficacy. And ideally, you have research papers that actually demonstrate that. It's very easy to claim that your solution works. It's a little harder to prove that. But mental health is only one sort of pillar of well-being. Very importantly, there's physical well-being, of course, as well. There's financial well-being, there's spiritual well-being, and there are other pillars. And just as we are told to eat healthily, to go to the gym, to improve our physical health, improving our mental well-being is hugely important. And all those factors are kind of connected. So resilience is really what we're talking about here. So sleep, stress, and stress management as well. And lastly, for the organization, these are the variables, the outcomes you really care about. So that's the productivity, that's turnover intention, that's the absenteeism we spoke about earlier. And ideally, you have a program that can show you the data that what you do with the employees actually improves the organizational health. And so very quickly, Intellect, from day one, that's actually the main reason why personally I joined the company, leaving my faculty position in NUS, was because we committed from day one to do proper science studies that actually show what we do works. And we are proven to lower anxiety, improve emotion regulation, and generally coping. And I don't want to go into the details of those. You find this on our website as well. But we have hundreds of sort of self-guided programs that we ran through the research tests. So for example, we developed a program to help people like their bodies more, to be kinder to ourselves. Many of us have a very sort of inner bully or inner critique, and so we developed content that can help people to be nicer to themselves. We improve stress management and anxiety and worry in general, and I'm very proud of this study. This was just, I think, 2 or 3 weeks we published a study that shows that our coaching is quite effective, actually, in lifting up employees' well-being. And this is the resilience study I just referred to. So if you engage in a step challenge and you work on your stress management using Intellect, we found that actually the next day your resilience is already measurably improved. It's a phenomenal study and quite exciting, actually, because we can all, with little things, going to bed a little bit earlier, doing a mindfulness meditation or journaling, whatever works for us. Of course, there's no one-size-fits-all, but these little things actually lead to improvements in your resilience the next day. Very exciting. So very quickly, Intellect is a mental health technology company. We offer end-to-end mental health care, so we have self-care content I just spoke about. We have an intelligent algorithm that matches employees and users with the right coach. It's very important that you get on with your counselor or coach, and it's all anonymized, and you can use multimodal channels. You can use the app or a web platform. You can even speak to someone in person if you prefer. If you're more towards the orange, the red range, we offer psychiatry and clinical psychology. We have a 24/7 localized helpline as well. We give on-site crisis support, and we do that in 22 markets across APAC. That's just another summary that we give multimodal access because we do recognize some of us prefer that we're quite techy. We like the app perhaps, or we like to speak to someone virtually, but many of us may still prefer the old-fashioned way of coming to a clinic and speak to someone in a counseling room. And this is an exciting quiz we developed a couple of years ago, which is called the Personal Insights Quiz. And if you don't have Intellect benefits, you can go to the Play Store or App Store. You can download the app, and this quiz will help you to identify areas of growth or areas where you're doing very well, your strength. And it only takes about 3 minutes, and it asks you about burnout, it asks you about anxiety, worry, stress, your job satisfaction as well, whether you can safely talk about mental health in your work, and so on. And if you are working in HR or if you're a leader in the company, what we do is we aggregate the data in an anonymized way, of course, to give high-level insights into the workforce's well-being, the organizational support, so do the employees feel supported, and also are people engaged in the company. And we have a staggering 14x return. I won't go into that, but if you go on our website, you'll find more information about it. But of course, in some way, it's a no-brainer, right? It makes sense to invest in our mental health. And people who are well, they're going to be, of course, they show up more at work, they feel more supported, and they're more willing to go the extra mile as well, and they're less likely to leave. I think this is my last or second last slide. So to sum it all up, we are available in 20 languages in 22 countries. We have 10 plus studies that are ongoing to really show what we do works. We quite proudly, we received the Best Corporate Wellness Provider Award from HR Online last year. And also 2022, actually, we were named the best app on the Google Store for mental health. And that's a QR code you can use to download our guide to prevent burnout, especially if you're sitting in HR. But it's relevant anyway for employees, so please go and download this little guide that'll help you to tackle burnout in the workplace. I look forward to the questions, and I'll hand back to our host. Thank you so much for your attention.
That was amazing. Thank you, Dr. Oliver. Now, question time. What is the name of your website, if you'd like to go, and the name of the app in the App Store?
It's called Intellect.
Just that, Intellect.
Intellect, yes. Just Google Intellect or intellect.co.
No?
Intellect.co.
.co. There you go. All right, so ladies and gentlemen, you know how to find this man and his community of well-meaning people who's going to help you. All right, so thank you very much for joining us. Thank you, Olivia. Thank you.